Welcome to In-Depth TV. My name is Dr. Joseph Santoso. I'm a GYN oncologist, and I'm very excited to have Dr. Susan Murrmann, very good friend and very well thought of in Memphis, Tennessee. Dr. Susan Murrmann, welcome.
Well, thank you, and thank you for having me on your show.
Please tell us about yourself, if you don't mind. How long you've been in Memphis, and what do you do?
Well, I'm a gynecologist. I used to be an OB/GYN, but 5 years ago I stopped delivering babies. I have been in Memphis probably 25 years now. I came here from Chicago. And I stayed because I like the medical community and love my own practice. And really want to take care of women and at all stages of their lives and focus mainly on that. And that's one of the reasons I stopped delivering babies. I love delivering babies, but I think I like to take care of the whole female patient.
And what is the name of your practice?
It's Murrmann Center for Women's Health and 360. We like to call it because we like to think that we take care of the entire patient, 360 degrees.
Wonderful. And it's located in Memphis, Tennessee.
It's located in Germantown, right on the border of Memphis.
Very good. Let's talk about the subject. We're going to talk a little bit, and it's called vaginal rejuvenation.
Yes.
Tell us, the audience, what is vaginal rejuvenations?
Well, it's a very hot topic, so I thank you for approaching this and hope your face does not turn red during the interview like some people do. But vaginal rejuvenation is a term that was coined a long time ago. And I'm not very fond of it, but it's what people know and what people research, or especially women, and actually their husbands or boyfriends will research. It's trying to take some years off what happens to the vaginal area when it goes through age. It goes through childbirth, it goes through lifestyle changes. Sometimes cancer can affect the vaginal area. And of course, when menopause, it extremely affects the vaginal area, and that's one area that does not stop. You may have stopped having hot flashes, but you don't stop the, and I hate to call it atrophy, but the tissue becomes less elastic and less moisture is produced, and it can cause painful intercourse, or it can cause other symptoms as dryness. Incontinence tends to actually increase during that time. So it's kind of the process of aging and different technologies now that have been developed to not reverse it, but restore your quality of life when it comes to the vaginal area.
How does that work?
Well, it's magic. It's really, there's several different types of energy devices that come into play. Lasers and radio frequency are the two most popular. And they both have a different wavelength and frequency and different way of acting on vaginal tissue, both the outside of the vagina and the inside. Lasers tend to be more what they call microablative, which means they heat up the tissue and cause small burns and tissue injury, hoping to produce collagen and elastin. Radio frequency penetrates the tissue a lot deeper, and actually 3 to 4 millimeters, and stimulates a lot of blood flow. And that blood flow in turn stimulates collagen and elastin production and more moisture eventually.
Very good. Let's go back a little bit for our audience. How common is this vaginal dryness, painful intercourse in, I assume, older woman?
Let me tell you, 100% of women will go through this in their lifetime. And once they hit that age, and the lack of estrogen or lack of use will make the symptoms a lot worse.
Wow, that sounds pretty serious. And so this is a device that...
Well, it's several devices.
Several devices.
Several different devices.
And it's inserted into the vagina by physicians or technicians.
Right.
And it causes abrasions or stimulations of new blood vessel to grow.
Well, eventually we want the stimulation of new blood vessels to grow. But if you look at two different types of the energy sources, and they really work in different ways. The radio frequency devices can also treat the external vulvar area and treat the inside. And the energy is applied. It's not just inserted, but the energy is sort of moved around the tissue that generates some heat. It never gets to a temperature that can burn you, but it generates heat. That heat really increases blood flow to that area. And if you do it repetitively, which is like every month for 3 months, you can see a big change in the tissue. Now, the laser will take 3 different times as well to actually rejuvenate the vagina, but it goes in, stays in, and causes little tiny burns along the vaginal canal that will help tissue kind of regrow into that area. Now, it only penetrates 1 millimeter depth, so I'm not really sure it's increasing the blood flow as much as radio frequency.
Very good. Do you offer that service in your practice?
We do.
Okay. Is it covered by insurance?
It's not usually covered by insurance, and it's sort of more on the cosmetic side. Although we believe that in our clinic we believe how you feel on the outside and how you look on the inside makes you feel better on the inside. So it's covered mainly as a cash only service to the patients. And insurance would have, the FDA would have to get involved and do some studies to make sure, is it indicated for like incontinence or is it indicated for vaginal atrophy?
Some of our audience would be very curious about costs. Do you have some number? How much will it cost?
Well, I think here you can see around $800 a treatment, whether you're doing laser or radio frequency. If you go to New York, 3 treatments will cost close to $4,000.
Wow.
Yeah, go to California, it's like $6,000.
Oh my!
And I was just recently in China speaking on this very subject in China with some Chinese doctors, and they were having it go for $15,000 American dollars in China. So it's a very big deal in China.
Of course. And tell us about the side effect again. I think what are the things that our patients should be concerned of or aware of?
Yeah. Well, I just do the radio frequency. I don't do the laser ablation or microablative laser treatments. I tend, you get 10 people that they believe in the laser or they believe in the radio frequency treatment, and I tend to believe that radio frequency is probably the best option. I have really not had patients that have side effects, and only a few patients, the only side effect I know is they say, well, I'm not sure if I notice a difference. But the majority of people do respond. Now, I have treated patients that have had the laser treatments done, and I have seen that there have been some side effects of worsening of symptoms, or I have seen 2 patients that have had small burns from the laser.
Mm-hmm. Recently, I happened to read something about FDA and this type of vaginal rejuvenations. Could you share with us?
Well, the FDA is famous for approving devices to do certain things, and then when somebody complains about it, they backtrack. And that's exactly what happened. They did approve all of these devices, but a very general type of improvement. Electrocoagulation of tissue and soft tissue rejuvenation. So they were not specific approvals for the vaginal area. However, ACOG, which is the American College of Obstetrics and Gynecology, came down with an opinion 2 years ago, basically stating that people were giving, mainly the industry that creates these devices, were giving false indication, saying it was indicated for incontinence or it was indicated for menopausal atrophic vaginitis, when in fact it's just soft tissue rejuvenation. So you have to give responsibility to some, I guess, of these salespeople that were trying to sell these devices for maybe falsifying claims. And I think that's what's happened with the FDA now is some people, there's bad apples in every bunch, are trying to say, well, this is approved for this particular condition, when it's really not. It's basically soft tissue rejuvenation. And the FDA named some companies, and they also said that there were some complications such as burns, which I can only imagine that the burns would come from the laser patients. Mm-hmm. But in any device that you're using, the female patient that's looking at these devices, make sure you know and trust the person doing the procedure. And I think every physician or whoever has these devices, it's their responsibility to know the physics of their energy device. Like, I read books on radio frequency before we did this. We did studies in our office, and we just published a study of 9 centers with the radio frequency device. And then I have my own actual study I did in the office with an ultrasound and looking at radio frequency energy and increasing blood flow. And I saw some pretty stunning results when I saw the blood flow that was increased to that area after they had their procedures.
Very good. So if you could summarize one more time, Dr. Murrmann. So what are the type of patient that would benefit from this type of vaginal rejuvenation?
Well, it depends. It's all quality of life. I think when patients say, I've had 4 kids, intercourse is not that pleasurable anymore, or it hurts, that's a candidate. Or someone is saying, I love to exercise, but I have a little leakage of urine. That is another. It's not an indication, but it's something that it can help. It's not 100%, but it does help in those instances. Menopausal atrophic vaginitis, I've seen
Which
a lot of
means
women.
dryness.
Which means dryness, painful intercourse, a whole gamut of issues that come with that. I have really seen some women turn around and become sexually active again, and feel better about themselves, and reestablish their relationships with their partners. And I think that's really, really important. It's not a cure-all, and but we have seen some good results, and I have seen some remarkable research that's come out on these devices.
Very good. Speaking about dryness in the vagina, there are women that use, because lack of estrogen as the woman age, they use estrogen cream in that vaginal area. Any efficacy on that?
Well, no, we know that estrogen vaginal cream, which now there are 3 types now that are on the market. They just came out with a new one, which I'm pretty happy about. Really can help increase. What it's doing is increasing the hormone receptors that were there at one time, and helping to plump up the tissue and make it more moist and make it more elastic. That in itself can help. However, what we've seen is women that are using estrogen vaginal cream and using the radio frequency device get an even better result when the two are put together, because you're getting the heat to get the blood flow, and now you're putting the estrogen on there, which can really get into the receptor sites a lot better. So you're seeing, I think, a better result with both of them. But some women can't use the vaginal estrogen because of hormone-related cancers. They do have a new DHEA suppository that's out now. It's a daily use that really stimulates estrogen, progesterone, and testosterone receptors in the vaginal area, but very locally. And that's proven to actually help women that aren't allowed to take hormones. And that works great too with the radio frequency device.
So that's a vaginal cream.
It's a vaginal insert. It's almost like a little tablet.
Very good. This is very, very informative. And then if our audience or our patients would like to get contact with you, what number should they call?
901-752-4000.
Let's repeat one more time.
Yes, 901-752-4000.
Thank you so much, Dr. Murrmann. It's been very, very
you.
informative. Thank you so much for watching us. And this is Dr. Joseph Santoso for In-Depth TV. See you next time.